Allegiance. Dear Heavenly Father, we thank you for bringing us here today to go about the serious business that we have to deal with of our constituents, our county, our staff. Lord, we just ask that you give us wisdom and how to deal with the situation in the most effective manner. Lord, we also ask that you be with the Drummond family and the Schmedeke family as they grieve the loss of their loved ones. Lord, we just ask that your grace and peace be with them as they go through the next few weeks. In Jesus' name, be with all of our men and women who work in harm's way during this crisis. In Jesus' name, amen. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Attendance. For the purpose of attendance, the clerk will call the roll.
Connor?
Here.
Geiger? Here. Gibson?
Here.
Jackson?
Here.
Parker?
Here.
Smelker absent. Wing?
Here. Approval of written agenda. At this time, any commissioner or member of the public may ask for an item to be removed from the consent agenda and placed under items for consideration. Hearing no such request and without objection, the agenda is approved as written. Reports from state and county officers. Does any state or county officer or their representative have a report to share with the board? Hearing none. Limited public comment. At this time, any member of the public wishing to address the board may do so for up to 3 minutes.
Good morning. Good morning. I'm Rob Heathis from 3525 Lisa Lane in Yankee Springs Township, and I am here to introduce our team Yankee Springs. We are a slate of individual candidates united by a common goal of restoring good government to Yankee Springs Township. We'll introduce ourselves. I'm Rob Heathis. I'm running for supervisor.
Larry Knowles, running for trustee.
Deb Musso, treasurer.
Dave Van Houten, trustee.
Mike Cunningham, clerk.
We ask for our township citizens' votes. We look forward to the privilege and the challenge to serve them. Vote for us in the August 4th primary on the Republican ticket. And I thank you.
Any other limited public comment? Go ahead, Rick. Sorry.
Rick Moore, Berry County Parks and Rec Commission. I'm here to inform you that the Berry County Roubaix has been postponed till October 10th of this year. And that's good news for the Trail Association because we don't have to write 200 checks to people for their parking spaces that they already paid for. So once again, it'll be October 10th of this year that the world's largest gravel road race will be in Berry County. Thank you very much.
Any other public comment? Hearing none, does any commissioner have any correspondence they'd like to share? I did receive an email yesterday. I'm trying to find it. It is from Jack Miner, who, I'll just read you his email. It says, "The healthcare folks recommend that old folks stay away from crowds. Someone reminded me recently that I fit that definition, so I will be absent tomorrow. If I were there, I would make this statement during first public comment. If you believe it to be appropriate, would you kindly read it for me? The most precious asset Berry County has is its people. The most treasured resource our county government has its awesome employees. Please, commissioners, do whatever it takes to protect them from the pandemic that will surely come to our marvelous residents. Warmest regards, Jack." So, any other communications? Hearing none, Consent item.
Madam Chair, I move for approval of March 10th, 2019 Board of Commissioners meeting minutes.
Support.
Moved by Gibson, support by Geiger, to approve the item listed under the consent agenda. Discussion is not allowed and the roll call vote is required. The clerk will call the roll. Where? Yeah, that is a typo. So, have it amended. Yes, please.
Connor,
Yes.
Geiger,
Yes.
Gibson,
Yes.
Jackson,
Yes.
Parker,
Yes.
Smelter absent, Wing,
Yes, the consent agenda is approved. Presentations, we have Colette Scrimger from the Barry Eaton District Health Department, and I'm sorry, I forgot the doctor's name.
Dr. Woodall.
Dr. Woodall.
Morning, everyone. Thank you for having us this morning. I'm Colette Scrimger, the health officer for the Barry Eaton District Health Department, and this is Dr. Woodall, who is our medical director for the district as well. Thank you for demonstrating some social distancing here by spacing out the chairs this morning as we try to work through the situation. I very much appreciate it. I just wanted to come this morning and give you an update of what's going on in our district in regards to the COVID-19 situation and talk a little bit about the response that we're doing. And then I brought Dr. Woodall with in case you had any specific questions about the disease itself and precautions that need to be taken. As of this moment, we still do not have any positive cases within the district. So Barry and Eaton counties still are without a positive case. We expect that to change at any time. We do have several pending tests out there, and the testing is taking several days to be completed, and so there's still a delay in that, and more tests are being ordered as we speak. So we do expect that any time now that situation will change. As you know, the numbers are increasing across the state, and more counties are getting positive cases as a result. Despite the fact that we don't have a positive case within the district, we are still pretty overwhelmed right now at the health department with the work that comes with the response to this pandemic. As you all know, the state of Michigan declared an emergency. The federal government has declared an emergency. Eaton County has declared an emergency as well. And we've been operating in emergency mode for quite some time now. What that looks like at the health department is that we are pulling many of our staff off of their regular services to respond to the situation. And the kinds of things that we are working on are not only are we taking calls from our citizens and our providers, but we are also in the process of doing contact tracing on individuals who may have been exposed to an ill person. And so what that involves is tracking down these individuals and screen them for their potential risk, and then discuss with them the strategies that they need to take to self-quarantine for a 14-day period to assure that they don't develop symptoms themselves. And that is happening with anyone who has been referred. So anytime somebody has been referred for testing, those individuals are being self-quarantined along with the other members of their household. And then we have to monitor that to make sure that they are following those precautions. In addition, anyone in these other counties around us that are testing positive for illness, those counties are doing contact tracing of people who may have been exposed, and the individuals who are residents of our district, we then are obligated to follow up with those individuals to assure that they are self-quarantining, to assure that they don't develop symptoms as well. So my staff are very actively reaching out to all these individuals to assure that the appropriate precautions are being taken. In addition, we are serving as a resource for the provider community as they are trying to make decisions about who gets tested and who doesn't get tested. Initially, in the response of this, all testing had to come through us in terms of if the providers wanted to order testing, they had to receive approval from the local health department first. Over the weekend, that requirement was waived, so the providers can submit the test without our approval first. However, they still have to notify us because anyone who's being sent for testing needs to follow these self-quarantine measures until their test results come back. And so we have to be able to follow up with them. So we're still dealing with a lot of calls with providers to understand what the individual person's situation is, evaluate that, and then follow up with the individuals as well. In addition, there's just a lot of complicating situations that come up that our nurses are having to respond to and try to work with these providers to figure out what really needs to happen. Does this person need to be tested? Where do we get them tested? Figuring out all those pieces of the puzzle. Dr. Woodall has been a great resource in that regard and has been working very closely with the staff to make the right decisions in these complicated situations. Separate from that, we are also working on our communications. So I have my communications staff who are pretty diligently trying to assure that the public is informed to the best of our ability. The situation is changing rapidly, and so we're constantly having to update our communications and get that information pushed out to the community to make sure that everyone is informed with the most accurate information. On Friday of last week, we did a webinar that all of you were invited to participate in. This was sent out to all of our community partners, and this was an opportunity to educate our community partners on what is going on with the situation, what precautions they could and should be taking, and then what they can expect from the health department in regards to a response. The webinar was very well received. I believe at the peak of it, we had 170 some people on it. And then it is on our website currently for people to go. It was recorded and it's on the website for others to go back and watch, either watch the webinar or at least look through the PowerPoint.
The link is also available on your Facebook page because that's how I got to it.
Okay, thank you. And so we are still referring people to that. Most of the information in there is still up to date in terms of precautions that businesses and other entities can take to protect their employees and make some decisions about what they should be doing. There are a couple of things that we are still assessing and trying to determine what needs to be happening. The two main issues that we're running into is the availability of testing. Most of the tests initially had been going through the state of Michigan's Bureau of Laboratories, and they have a limited capacity. And so that process has been very slow, and the state is working hard at expanding its capacity so that they can process more. At the same time, the private labs are trying to get on board to do this testing, but that has been slow to come. And so what we hear most often from people is, where can I get a test? And there's really two parts to the testing. Just, if you think about your normal testing that you get at a doctor's office, they might order a blood test for you. They collect the specimen, but then they send the specimen out to a lab to be analyzed. This is a similar situation. We need the providers to collect the specimen, and then it gets sent to the state of Michigan for the analysis. We at the health department do not do testing. We are not able to collect a specimen or do the testing based on our current capacity at this point in time. And that's a lot of the confusion in the community, is that many people are calling us saying, my doctor said come to you to get tested, and we just don't have those resources. So we are directing everyone to their provider. Their provider either can do the test or the specimen collection within their office, or they can refer them to the hospitals to see how the hospitals are doing that if they're not able to do it within their offices. Some of the limitations that providers tend to have, and Dr. Woodall will certainly be able to speak to this more, is the availability of personal protective equipment to do the specimen collection. There is some requirements on what PPE needs to be used when the doctor's offices are doing this collection. And many of these doctor's offices don't have the adequate equipment to do so. And so that is sort of what's creating some problems in availability of testing in the community. Across the district, we are working with our 2 regional healthcare coalitions to discuss this issue and figure out what options could be available for the community. I'm sure many of you have heard on the news about some communities who are doing drive-through testing sites. Spectrum in Grand Rapids has been doing that. It's my understanding, based on communications with Penix CEO, that they are expecting to roll that out to their other sites as well. So we are waiting for that to come. And then in the Eaton County side of it, nothing is happening immediately within Eaton County, though nearby Jackson County has been doing some drive-through testing as well. Those are options that we are trying to explore and look into in partnership with our hospitals, and based on the availability of resources and the demand for those services. And so that's a piece of the puzzle that a group of my staff are starting to, or have been working on analyzing and figuring out what options are available. The other piece of the puzzle that we are working at the health department and trying to take leadership on is this issue of resources in terms of personal protective equipment. And there's been some activity this week in regards to some release of the Strategic National Stockpile, or the SNS, and they will be releasing a portion of that out to communities in order to get personal protective equipment into the hands of those who need it most, the providers in the healthcare community. And so we will be receiving that on behalf of our district, and then we will be working with our providers to distribute that to those who most need it. It's a very small amount of supplies that we are getting at this point. This is a federal release of the Strategic National Stockpile, so Michigan is getting a portion of it based on its population and its cases and whatever factors they're looking at, and then the state is looking at distributing that to the areas most in need first. And so at this point in time, we're only getting a very small quantity that then we will work with our regional healthcare coalitions to identify who's most in need within the district to receive those materials. Once we get, I guess I'll talk for a minute about once we get a case, we will be working with that individual to do, as I've talked about, the contact tracing back, and then also determine the precautions they need to take to isolate. Depending upon the case, if the individual is hospitalized, isolation is a little bit easier. But if it's an individual who is ill and able to stay at home, then there's some additional precautions that need to be taken to try to prevent the rest of the family from getting ill. Clearly, that household will be quarantined under those situations to assure that they don't develop symptoms and spread it in the community. So, and each time a case comes along, then that's what we will be doing until some point in time when the state declares that its presence in the community and these types of efforts aren't necessary anymore. We just don't know when that will be. Starting today, the health department will be moving into a 2-shift process. So we will have staff working from 8 to 5, and then a second shift working from 11 to 8, I believe it is. We also have staff working after hours or overnight as well, on call for providers and for any other situation that develops. We had probably a team of about 15 to 20 individuals working all day Saturday and Sunday of this past weekend, and we expect to continue that going forward into this weekend. And then we'll just take it day to day after that to decide how long that continues. We expect we have not gotten the worst of it, so we do think that that will, that type of response in terms of day-to-day weekend coverage is going to happen for quite some time to come. I guess I will pause there and let Dr. Woodall speak to the more medical care, healthcare side of it and offer his perspective of what he's seen happening, and then we can answer any questions.
So I think the takeaway right.
Pull the microphone.
So I think the biggest takeaway right now is that we're trying to institute as many public health measures as we can to keep the number of cases as few as possible. But as far as the curve goes, I think we're definitely still on the upswing of that. And as testing becomes more available, we expect to see more positive cases. So in the meantime, the public health measures that are coming down will hopefully flatten the curve, is the phrase that you've probably heard. And that's kind of where we're at right now.
Any questions for Colette or Dr. Woodall?
I've been asked how long the restaurants are expected to be closed.
The restaurants?
Yes.
I don't remember the date off the top of my head on the executive order. I think it was the end of the month at this point in time, but that was the governor issuing that order, and so I apologize, just the date's not in my head. So whatever that order said, and then I'm sure it will be reevaluated based on the situation to determine if it's extended. Keep in mind that the restaurants aren't closed. They can still do takeout, drive-through, and delivery. And so, I encourage those of you who are able to continue to frequent those businesses in that manner.
Dr. Geiger?
My first question is for Dr. Woodall. We've been hearing concerns about hospital capacity. What's the current situation in our hospital here in Hastings?
We have adequate capacity at our hospital here. So that is definitely a theoretical concern as the peak of this curve gets to the top. Is it possible that the health system could be overwhelmed? The answer is yes, but I think as long as we stick to our public health measures that are being instituted, our capacity will remain adequate.
Okay. And Colette, the governor issued in an executive order prohibiting public gatherings of a certain number of people or higher. What's that number currently at?
10 or more.
10 or more, okay.
That from the governor, or what's the president's recommendations?
I thought last night the governor also issued the 10 or more order.
Because I know she rescinded one that rescinded the 250 and dropped it down to 50, and it's really hard to keep it ahead of
Yes, I agree.
the rescissions.
I'd have to look, and when I get back to the office, I can double check to see if it's a 10 or more at this point, or if it's still the 50. I thought I was seeing last night 10, but that also could have been the recommendation and not the order.
Right. We can pull it up and make sure we get it posted on our website too. This side, questions?
So you talked about when you right now are doing going out and checking with people that haven't tested positive, but you're waiting for their tests to come back. And so you said you're doing contacts and everything. And then you said if someone tests positive, you'll be doing the same thing again?
So right now, if an individual has been submitted for testing, we are starting to gather some of the contacts. Their immediate household members are being self-quarantined until those test results come back. We have them start gathering information of who they may have come in contact with while they were symptomatic, so that if the test result comes back positive, we can start doing the contact tracing.
Okay, so it's kind of in process, but it just gets more in-depth.
Right.
Are you having any pushback from people that don't want to self-quarantine? Especially like maybe family members?
You know, I think for the most part, people have been very cooperative.
Good.
We've had an isolated case here or there where there were some unusual circumstances that, you know, staff have had to work through. But not many. The norm is people to be very understanding
Good.
and appreciative of what's being done.
Good, excellent.
What I would say, though, is we are still hearing about people who aren't taking the precautions of staying home when they're sick. So fever, cough, shortness of breath, stay home. Just stay home, please. And we've had situations where they are putting that, you know, especially when they're going to work, they're putting that workforce at risk. So as an example, at the health department right now, we are being very careful not to huddle as a group, which is our usual norm. Few of us gather into a private office to do our work, and we've put a stop to that. We're not even meeting in our conference room anymore. We're meeting in an open space, spread out, or we're staying at our individual desks and doing go-to meetings. Because the reality is, if one of us ends up sick, we are now putting all of these people that we've been in close contact with at risk for having to self-quarantine, and then our public health workforce is shut down. So, and I encourage all of you who have businesses or I've spoken with Michael about this and with John Fuentes in Eaton County, that you guys should be taking those precautions as well, especially for our first responders. Really do some good screening of your staff to make sure that they are not coming to work sick. No fever, no cough, no shortness of breath. Send them home if they are. Because the risk is you're gonna, if one of them gets sick and has exposed the others, all of those individuals need to self-quarantine to make sure that they don't develop symptoms, at least until a test result comes back.
Are you self-testing at your office? I mean, are you testing your employees as they come in at your office?
We are not doing, we're encouraging employees to do that themselves.
Okay, I just wondered. I
But-
hadn't heard anybody doing it yet.
We are, some of the hospitals are starting to do
Okay.
temperatures and that kind of stuff as people come in. We are limiting the services that we're providing, so we have very few public coming in, and we have big signs posted about if you're sick, don't come into the building, call us, and we'll respond at that point, so that we can reduce that exposure. But there's still people who, you know, yesterday I heard about an individual who came into the building, walked past probably 3 signs that said, "Stop if you are sick," and he came in anyways and said, "I'm sick, I need to be tested." And so, you know, that
Yeah.
we really need people to just stop and stay home, call first and get instruction on what to do.
Okay, thank you.
So just for point of clarification, Executive Order 20-11, beginning on March 17th, 2020 at 9 a.m. and continuing through April 5th, 2020 at 5 p.m., all assemblages of more than 50 people in a single indoor shared space and all events of more than 50 people are prohibited in this state. A single indoor shared space includes but is not limited to a room, hall, cafeteria, auditorium, theater, or gallery. So
So it's still 50.
it's still 50
Thank you.
for now.
With the recommendation of 10
Probably, I
from the
haven't,
CDC.
well, the CDC and the president both said that last night, so I watched as much as I could. So, but this also rescinds the Executive Order 2025 that had it set it at 250, so, yes, sir.
Me? You?
Whoever.
All right. Dr. Woodall, you mentioned something about overwhelming a hospital.
Dan, can you sit closer to my?
Sorry, thank you. You mentioned something about overwhelming a hospital. What kind of things would overwhelm a hospital if you have two, I mean, at what point are those patients at then? Are they just not feeling good, or what's, how sick are they then at that time?
So, I mean, the overwhelming majority of people who get this virus are not going to need acute medical care. And the ones that do need acute medical care would simply need a hospital bed for more monitoring. The real risk is the limitation of number of hospital beds or ICU beds specifically. But that's the smallest percentage of people who get this virus that would actually need these acute ICU type beds. So in terms of the theory is that if you have a massive surge at the peak of the curve, that number of people who need ICU beds could exceed the capacity. But that's a theoretical concern. We have the best healthcare system in the world, and I think the risk of that happening in the States is very low.
Okay, all right. All right.
I would just add that, the comparison that I saw about this compares it to the toilet paper issue. That if, just like we saw everyone rushing out to buy toilet paper and now there's a scarcity of resources of toilet paper, the same could happen with hospital beds. And so if everyone gets sick at the same time and needs that demand on that healthcare system, there's going to be a scarcity of those resources. And so what we're really trying to do by taking all of these public health precautions of social distancing and forcing people to stay home is slow the spread so that we don't have everyone racing to the healthcare system at the same time for care. And we don't run out of toilet paper.
The other question I have is, could you go, is it basically the blood test that is going to determine whether they have the virus or not?
Yeah, so right now, the standard of care is to get what's called a nasopharyngeal swab, so a nose in the back of the pharynx, and you send that for what's called a PCR study. So there's no blood test right now for this.
Okay, thank you.
Commissioner Jackson.
Yeah, going back to Dan's question, talking about the system, do you know how many ICU beds are available in the district at this point?
Spectrum Health Pennock has 3, with the potential to add more in an acute crisis situation. And I can't speak for Hayes Green Beach, but I would imagine it's similar or perhaps a little less.
Okay. And my other question was on testing. So there wasn't really I've heard some on the media talk about a Roush test that they're going to roll out for the labs, for private labs. Is that something that's in the works or something that's coming that so either hospitals or private labs can do testing quicker, more accurate?
Yeah, so so there's talk about having the ability for a given institution to run the test on their own. So we call that a send-out lab, so which causes a delay in care, right? So if I have to collect a specimen and then mail it somewhere, there's a delay there. Whereas if I can collect a specimen and run it in my institution, it's much quicker. That would be future state for sure. I don't really see that happening anytime soon.
Okay, so there was not a test that kind of fit the bill for this virus prior to this coming out a month and a half, 2 months ago when this started in China, that there wasn't a known test that they could use?
In the private sector, no.
Okay. Because there's the perception that we were way behind on this, but there wasn't really a way to identify this, or really the thought wasn't there beforehand, so.
I guess it's a bit subjective to say that we were behind on it. I mean, I think truly if you look at the wide breadth of our healthcare system is private, and these tests are being done in the public sector. And so I think we've actually done not too bad in terms of testing. The biggest problem is we're relying on state labs to do it, and it would be great if the private labs could really step up and handle some of that bulk testing need. But yeah, so for right now, it's all being done through the state lab.
And you don't think that's going to change in the next week or 2 weeks? Are they going to slowly come online, or?
Yeah, so I think it will, but I don't think it'll be done at, like, say, Spectrum Health. So I think what you'll see is other private lab vendors who are already in the business of doing these types of tests will be doing it. So Quest and LabCorp would be the 2 in Michigan. I've heard and read that there is the availability to do that testing through these centers now. I just haven't seen that happen in real time. But I think, yeah, those labs will step up and start to handle some of the aid and some of the burden that the state is experiencing. And so there is actually guidance out right now to providers from the state for if you do send your specimens to a private lab and what the notification process is to let us know so that we can do the appropriate public health part.
Okay. And just to kind of reiterate, you read about, there's so much information in the media, social media, comparing this to H1N1, to SARS, all the other different things that we've been through over the past years. Why is this so much more dangerous? At least the perception of this is so much more dangerous than anything we've been through in the past.
Yeah, so that's a great question, and this is such a tricky virus because it has a lot of similarities to influenza, but it also has a lot of differences. So I think the key takeaways and why people have a tendency to blow this virus off. So it really comes down to the age stratification that you're looking at. So what's the risk of your population? So if you look at young people, most of them, potentially as high as 90% of people, can be totally asymptomatic the whole time that they have this virus. They're passing it to others at that same time, but they just have the sniffles and then they're fine, never requiring any kind of medical care. But if you look at people who are 60 or over, they get much more severe symptoms. So the mortality is the key takeaway here. So for people who are 60 or over, and this data changes on a daily or every 12-hour basis, mortality in that population can be as low as 4% or as high as 14%, depending on the population that you're sampling. So if you think about the number of people in our country who are 60 or over, and if you look at 4 to 14% of them having the risk of mortality, then that number's in the millions of people. So right now, national mortality in the U.S. with this virus is 1.9%. Globally, the mortality is 3.9%. But you have to consider that that's just the rate based on the number of people who have been tested. So it doesn't include all the other young people who have the sniffles and never get tested because they have the virus and then they're fine. But if you think about in this country, there's 340 million people. People over 60 is probably, I want to say, around 60 million. I'd have to check that out. But if you think 4 to 14% of 60 million people are potentially going to die if they get exposed to the virus, then that number's in the millions, and that's why the concern is so high.
Interesting. So when you see, I don't know what flu deaths are. Do you have a number on what just common flu, if there's such a thing as common flu? What
Absolutely.
flu
So influenza is tracked annually, so and it's estimated. So deaths from influenza in the U.S. for this season varies from 20 to 50,000 deaths annually for adults. The only ones we really track to the number are the pediatric deaths. So about 146 kids have died in the U.S. this year from this flu season, and this has been a pretty stable number throughout the years. So, and that's why when you look at influenza, that's why there's danger there, because if you're not interpreting the data the right way, it can seem like the flu is much worse than the COVID, and it truly isn't. So there's been 140-something deaths of kids this year from influenza. There's been 0 deaths of kids from the COVID virus. There's been 20 to 50,000 adult deaths from influenza this year, and there's only been less than 100 COVID-19 deaths this year. But it's what the potential that this virus could do, because the secondary attack rates or the transmission is much higher with COVID-19 than it is for influenza. So when you have a virus like that has the potential to kill that many more people, because that 20 to 50,000 deaths for influenza for adults in the U.S., that's still less than 1%. Whereas when you're looking at COVID-19, the same population, especially 16 and over, it's 4 to 14. So like you saw in Washington State, when this virus gets into a nursing home, that's when a lot of people die. So that's that 14% or more number, because those individuals are all old with multiple comorbidities, and those are the people that are going to die.
So a child can carry this, adults can carry this, and show very little symptoms of it. But when it hits somebody in that 60 and up risk category, that's when it can become catastrophic.
Absolutely.
How long, and I've heard 14 days, but is that accurate as far as how long you can actively carry that virus?
Yeah, so we're still learning what the true incubation time is, but the best estimates right now are 2 to 14 days. The median, which is where most people fall, is in that 5 to 6 day range. But so yeah, so there's And granted, a lot of this study is coming from the Chinese, a lot of the data is coming from the Chinese CDC, but I read a report yesterday that of all the pediatric cases in China, 90% of them had 0 symptoms.
Interesting. Do you foresee this type of restriction or type of protocol coming down from the federal government and state government kind of being a new normal going forward?
You mean with what we're dealing with right now?
Just how we're closing bars and schools
Yeah.
and restaurants, and because it's obviously unprecedented for what we've been through before.
Absolutely.
And we've had lots of things that have been scary viruses in the past, but like I
Yeah.
said, we've just never seen these kind of steps as
Right.
far as the restrictions that are
Yeah.
being asked of society.
And I think the takeaway for that is, you know, because of what the potential that this virus has in terms of potentially killing millions. As far as how long this is going to last, my best guess is several months. You know, the overwhelming optimistic hope is that with the warm weather, this virus the numbers will start to fall off. And if that happens and numbers start to go down and evidence of community spread goes away, then this stuff will go away also.
Okay. What is a timeline? Are you hearing anything about a vaccine?
So the first Americans were tested with the first vaccine yesterday. I think 10 of them were administered in the state of Washington. Realistically, for that to become commercially available to Americans, unless the FDA took massive, unprecedented steps, I would guess at least a year.
Okay. So, in your opinion, do you see the curve flattening out in the warm weather months like you do with the flu, or is this something that can continue to gain momentum throughout warm weather months?
I mean, I think based on the best available data that we have, which is global health data from other countries that aren't necessarily as great about data collection as we are, I think that evidence has really shown that the curve will start to go down.
Okay.
But we just haven't peaked yet. So that's why these measures are also hardcore, because we're still going up like this.
Okay. Well, let me just say that on behalf of our board, we appreciate your weekend work, staff overtime, the things that you guys are doing, because like I said, this is kind of new territory. And being on the Board of Health, we've seen a lot of things pop up, but nothing like this. So it's getting some of the emails and seeing what your staff are doing. It's amazing the amount of effort and energy that the staff is being put in. And I don't know how they're being compensated or what they're doing, but there's a lot of energy going in. So we appreciate everything you're doing to protect public health here in Berry and Eaton counties. Thank you.
The sheriff has a question. I just kind of want him to get close to Mike so everybody can hear him.
I'll say it aloud. Can you give the public a number for a fever? Like,
Yeah.
what?
Absolutely. So the definitions of a fever are 100.4 in Fahrenheit or 38 degrees Celsius, which is really the best way to check it.
100.4 is what we'd be, okay, thank
Yep,
you.
absolutely.
I do have a question that may seem a little different. We have had coronavirus here in the States for a long time. Large animal producers actually vaccinate their cattle for coronavirus. How is this coronavirus different for what we currently vaccinate for?
Yeah.
And then is there a risk to our food supply being infected with this current virus?
Yeah, so viruses come in large families. Coronavirus is a family of virus. Within those families are multiple or hundreds, if not thousands, of strains of viruses. So people have been getting infected with coronaviruses in the States for decades. And we do tests for coronaviruses in the States from time to time. This specific coronavirus is SARS-CoV-2, which is a brand new virus like we've never seen. And so that's what the big difference is this is a unique DNA fingerprinted virus that is not like the other coronaviruses that we've seen.
So is there any data that shows maybe, I don't know, are our animals subject, I mean, are they going to get sick too?
Yeah, so I haven't seen human to animal transmission of this virus, but the theory is that this virus came from animals to humans, right? So that, is not an unreasonable question to ask, I just haven't seen that zoonotic data yet.
I'm a dairy farmer, so this is really a big question, and we're looking at fair projects coming for the 4-H in the next few weeks and getting ready for fair in June. And just for those of us who deal with large animals, which is only about 2% of the population, it's a question that we need to ask too, and how do we safeguard our farms and our fair projects and our kids from transmitting this back and forth. So,
Yeah.
Thank you. Any other questions, Vivian?
I don't know, question, but I'll direct it at Colette. So, like, you know, the issue with us doing our jobs is we can't do our jobs unless it's open to the meeting, open to the public. And so I know that the Michigan Association of Counties has reached out and asked us to reach out to our legislators about this. We project the majority of Michigan's 622 county commissioners fall within the high-risk group of individuals ages 65 and over. We're missing one person here, but 4 of us are over that age. So, but like, we can't do our jobs without some relief on that Open Meetings Act. I don't know if you can say something to the executive office to kind of have them look at that. I don't mind doing my job, but we cannot do it without inviting the public.
As I understand it, the governor's office already released direction that you could go virtual for your meetings, is how I've understood it. And so that as long as that meeting is still made available for public participation. So I do think that there has been some information that has come out along that regards, so that, and that there's been some direction on it. And so I'd look for that and see if you can make virtual meetings happen.
It would be Executive Directive 2020-2 that addresses it, but there's still not a clear guidance on how to perform.
Yeah, I did read that. There's not clear guidance regarding this level of government, you know, so.
Thank you, folks.
One last thing that I would say is, starting today or tomorrow, we will be sending out periodic situational reports to keep our community partners updated. We'll be pushing those out through a email contact list that we created for people who wanted to. You can sign up for that on our website. If you signed up for the webinar, you'll be automatically put into that distribution list. I will also make sure that those are sent out to Michael and John Fuentes to distribute out to the full boards of commissioners as well, and any of the other county departments that would want to see that. And that will just be a regular update of whatever data we have to report, and then new information in terms of guidance or responses that we're able to give you. So, and we expect that those will come out every 2 to 3 days based on how frequently things are changing.
Any other questions for Colette or Dr. Woodall? Thank you very much for being here this morning. How about we take a short break before we proceed? 5 minutes?
Did you?